We're very fortunate to have with us tonight Dr. Andy Coates, who's with Physicians for a National Health Program and co-chair of the Single Payer New York System, Single Payer New York, which is part of a campaign group. He will pick up on some of the themes of the volume, but also comment on some of the current issues of healthcare struggles in the U.S. So I'll turn it over to Dr. Coates.
It's an honor, a distinct honor to come and have the chance to speak with you. About a decade ago, I got out of training after medical school and started seeing patients. And one of the very first patients I saw had pneumonia, and I was very proud of the fact that I had done some extra work on the community prevalence of organisms and antibiotic resistance, and I knew what I thought in my mind was very likely to be the cause of his pneumonia, and I knew exactly the drug to treat it, and I prescribed that drug, and he came back to the clinic explaining that there was no way that he could afford it. And I went to my preceptors and said, how is it possible that you would teach us with a straight face the state-of-the-art medical science and never tell us that the economics trump our ability to practice that same medicine? And how do I learn about this? And little by little I learned that if you knew how to decode the sticker on the chart, you could find out who the insurance company was, whether the patient had Medicare or Medicaid, whether the patient was quote-unquote self-pay, meaning uninsured. And then I learned that there was a discrete dance when you had to talk about the money in every interaction with every patient. And I was just a medical intern trying to see a few patients and trying to help some people. And I started thinking very hard about this question, but I was already a socialist. So this is pretty powerful stuff, this morbid symptoms. Any serious political economy of health under capitalism must be centered on the fundamental contradiction involved. Healthcare, and are use values par excellence, of limited interest to capital unless it can convert them into exchange values. We've just heard Rodney talk about that measure of the contemporary class struggle. Where publicly funded health services were secured, the productivity of a healthy workforce was always a key element in capital's acquiescence. Where publicly funded healthcare becomes seen as a problem for accumulation, the use of health and healthcare must be obscured and distorted. Much public discussion of and official policy toward health and healthcare today has the same. The basic requirement for a valid political economy in health and healthcare is to subject all discourse and all policy to critical scrutiny, but that is by no means enough. What is essential, especially for building effective forces of opposition capable of organizing on this terrain, is to make the fundamental contradiction of health under capitalism the pivotal issue of a revitalized socialist strategy. And I have come to see this very much in my mind, in my own work, in my own activism, that when we're talking about the health of human beings and talking about the unfulfilled promise of the society in which we live, we're talking about the fundamental contradiction that can get us where we need to go. This is the way to begin a transition to a new society that will have human needs and our best interests ahead. It's that in that contradiction lies the hope. And so what you'll find in morbid symptoms, we heard about from Pat about how EBM had its unintended consequences. This bid for autonomy and science and introduction of some basic bridge from the bench to the bedside in the clinical work of doctors then has its unintended consequences. And I can have my own anecdote, which is I teach evidence-based healthcare at the medical college. And of course, the full-time salary model was a fiction of the early 20th century, long since gone, and so we're volunteer faculty. And my colleagues overwhelm me as insurance company executives teaching evidence-based medicine to the students. And the reason that they want to teach the evidence-based medicine is because if they know it, then they know the evidence for denying patients care. many times in this volume, the great contradiction, the inverse care law of Dr. Tudor Hart, that the more people need care, the less they can get it. The less people need care, the more there is. And I think Rodney really points out that health is a growth sector. You know, the galloping increase in cost has to do with betting the farm on making more and more profits there. And it guarantees us that we will find fertile ground for our activism if we pay enough attention and if we know the details like Rodney can teach us. But one of the really great contradictions is in Collins' essay about the sanitation movement. So, you know, the physical sciences made great profits and were, you know, wonderfully encouraged by capitalists. But there was the unintended consequence that we figured out that sewers, all by themselves, could have this enormous impact on the human lifespan. And it was that science that then came back to bite the capitalist class in the butt against their best interest, against their desires. And so you see these contradictions, and I think that if we can begin to think of healthcare and health under capitalism and these contradictions as advocates and activists, we can begin to figure out what to do. And the international lessons are absolutely crucial, and that's why, with 17 essays and 19 authors, this is the kind of book that really everyone needs to read. We need to get it into the hands of people who are not thinking about healthcare, people who are not socialist-minded, people who really just want to think about some evidence. And that's where Colin concludes, you know, that we can have a new common sense if we only have a vocabulary to talk about what really works. I had the honor to hear Marie Gottschalk in person deliver the paper that she has here. We spoke at NYU. And, you know, the contradiction in the United States, I think her Stockholm Syndrome analogy is exactly right, that the establishment, and the establishment meaning the Progressive Democratic Party and the mainstream Democratic Party, so identify with their captors that they wouldn't know when an opportunity to escape arose. And so now we're coming to the denouement of that. And rather than talk so much about where we are right this minute, in terms of the mainstream politics, why don't I just give you a brief report from the point of view of where I think we are in building a nascent social movement for health reform. In New York State, we founded this single payer New York because we anticipated that Obama would be elected, we anticipated that Bush would be rebuked, and we anticipated that the expectation for meaningful change, real change, was going to be there. And we were pretty much right about that. And we really found wind in our sails. We found unprecedented possibilities to speak about Medicare for all in the United States of America all through 2008. We thought that that was a little odd because what usually happens in the presidential election is it's the low point of politics. And what they will say, the best advocates campaigning for their guy, is that your proposal of Medicare for all is not on the, what do you call that? This is not our platform, this is not our program, and so you guys need to go away until after the election, we'll give you another chance. And instead what happened was we got invited in parallel to the campaign. We got invited by people campaigning for all the candidates. They wanted to hear what we had to say. We thought that was different, so we founded a grassroots organization. What was happening in the labor movement was a series of endorsements for HR 676, the House bill for single-payer national health insurance. It's an elegant piece of legislation. It's only 30 pages. It had now 86 co-sponsors. And we simply asked people to sign on and say that they supported it. What we thought at that time was that if enough supported it, well, let's tell the story this way. I heard Pete Seeger one time in Cooperstown and telling this dialectics illustration. You know, there's a great big scale, seesaw. On one side there's this gigantic pile of rocks holding down the other end. The other side is an empty basket. In the empty basket, people are putting sand in with little teaspoons, and we join in. We get our teaspoon and we put our teaspoon of sand in the big basket, a giant pile of rocks, and everyone laughs at us saying, you're never going to fill that basket up with those teaspoons. That is ridiculous. And of course, one day, zoop, there goes the seesaw, and everyone then says, how the heck did that happen? So the modest proposal was, if we could get enough unions to support HR 676, maybe the whole AFL-CIO would move. And then I was personally involved in New York State, going from Central Labor Council to Central Labor Council, local to local, and getting very good response. And then in the summer of 2008, we went to the AFL-CIO New York State Convention, and they said, of course, look at all these unions that want to have single payer. New York State AFL-CIO is for single payer, and now I think 39 or 40 state feds are for single payer. And that happened at our Central Labor Council in Troy, New York. I should say I'm shop steward in Division 231 of the Public Employees Federation, AFL-CIO. Our Central Labor Council sent the resolution to all the other Central Labor Councils in the country and said, let's get this through the national AFL-CIO. And there's an amazing resolution in favor of social insurance that came through the AFL-CIO this August, in parallel, of course, to an endorsement of whatever the president might want. It gives us a place, it gives union officials some cover, it gives us a few resources, and little by little, if we keep this endorsement campaign going, we think it will give us the kind of legitimacy to tip the whole seesaw. When Obama did his transition campaign, they had healthcare house parties. They had thousands of house parties. We know that maybe half of these house parties, but at least a quarter of the house parties were overwhelmingly saying that the president should endorse single-payer Medicare for all. The Democratic Party report that was written about those house parties obscured that fact. Then when the president was elected in February, of course, health reform cannot wait, it must not wait, it will not wait another year. It was only a year ago that he said that. And everyone expected that health reform would happen. Then they announced that they would have White House meetings about health reform, and we were excluded. Max Baucus, the chairman of the Senate Finance Committee, said everything's on the table except single payer. So when the White House started its forum, Dr. Robert Czar said, I'm going to go picket you guys with my white coat and all the doctor friends I can get, and I'm going to protest our exclusion. And about 6 hours after the leaflet got into the White House, Dr. Czar got a telephone call that said, what time can you be there? We need you at this meeting. We don't want anyone picketing. And so we were in the White House. And so was then Congressman Conyers. The Senate Finance Committee hearing started, and Dr. Margaret Flowers and Carol Paris and others, 6 others, went and disrupted the hearings and were arrested. And this electrified the single-payer movement across the country. The Senate Finance Committee hearings tried again, and 5 more single-payer people disrupted with civil disobedience, and this electrified the movement. Then when the Senate Health Committee met, they called Dr. Margaret Flowers and said, can't you come and testify? And it's kind of funny because they didn't really have a place to put her, so they put her next to Andrew Watson, who was paid $25 million for CEO of an insurance company last year. And they didn't put her on the table, they put her kind of on the end, just almost on the table. But they had to have her testify. And then when the House did its testimony, the single-payer people had a voice all the way through, until the one committee, the Energy and Commerce Committee, was trying to get the health reform through its committee. And Congressman Wiener said, you know, we're going to propose an amendment. We're going to replace the 30-page single-payer bill with your entire bill. You take your 1,000-page bill and do a substitute amendment. And they couldn't get rid of Wiener. They didn't know what to do. So they offered him a deal. They said, we'll put your bill on the floor of the House. We'll put your amendment on the floor of the House if you go away. Lots of twists and turns in the struggle. But even 2 weeks ago, President Obama said, I know that many on the left are disappointed, you know, we couldn't do single payer. They still have to say single payer. We have a movement now that in Maryland, I understand last week they had a sellout meeting. They were supposed to lick envelopes and have a couple dozen people. They had like 100 people. They didn't know where to put everybody. In Vermont, there were several hundred people at the State House 2 days ago, and dozens of people before that. And it looks like there'll be resources in Vermont to propose state-based single-payer legislation. In Pennsylvania, the single-payer movement is having hearings in the chambers of the Congress and the state legislature. And in California, last week in the Sacramento State House, led by hundreds of medical students, there was an incredibly vigorous statement that California should have single-payer. So my proposal would be that not only is it true that we can have a new common sense and drive into this contradiction and figure out how to find a way forward in the interest of human health and human well-being and the kind of society that we all want to live in. But I think that we'll be joined by millions of others millions of others in this struggle if we have the courage of our convictions. And so everyone should read Morbid Symptoms. If you subscribe online, you get to read 46 years of the Socialist Register. And I'm so grateful for the invitation. Thank you.
We brought Andy up to hear about the healthcare struggle, not to make the pitch, but thank you. We'll now turn to Natalie Mehra of the Ontario Health Coalition to update us on the current healthcare struggles in Ontario.
Thank you very much, Craig. Boy, you can never feel sorry for yourself in Ontario listening to Andy talk about what's happening in the United States. Imagine that, trying to create a single-tier, or as he's calling it, single-payer healthcare system in this globalized economy. I want to recognize two people just before I start. Ross Sutherland, who's on the board of directors of the Ontario Health Coalition, who drove in, I think, from Kingston today for this. And Sarah Rayburn, who's here somewhere, who founded the Students for Medicare. Where are you, Sarah? She's hiding. Oh, there she is by the bar. Great. Thanks for coming. I also want to thank Leo, Colin, Greg, all the contributors, the editorial collective, and the publishers of this book that I think is very important. In fact, I'm going to try and make my board of directors read it. I also want to thank Fernwood Publishing and Leo for offering to make this launch a fundraiser for the Health Coalition. I assure you that your funds will be well spent, and they're very much appreciated. As I think others here have said, the book is actually, it's an incredible collection from global contributors, and many provide, I think, very insightful descriptions and analyses of the contradictions and challenges, the sometimes mortal or morbid challenges to the goal of public health as an egalitarian, cooperative, and democratic, to steal a phrase from the forward, Colin, undertaking of society. In my work, this type of analysis is grounding. It provides a counterweight to the ever-present pressure to conform to market-based processes and their so-called solutions. Pressure that I know that I feel constantly to conform to the narrow range of options that are provided for us or offered to us by government, through government policymakers and bureaucrats and other elected leaders, but also pressure, quite frankly, that comes from within our own movement, from within the labor movement and within the social movement. The book also provides inspiration. It reminded me and brought into sharp relief contradictions that I'd forgotten, including the central contradiction that I think Andy quoted in the book. It gives a historical analysis of health systems here and elsewhere that one cannot easily find, at least I've not found in English anywhere. I found myself reading it, I have to confess, at 4 o'clock in the morning last night, scrambling to take notes as fast as I could read. I don't know at the end of it if I'm any closer to figuring out what to do that will make the most difference, but I do have some ideas to thank you, the authors, for. In our work, building a social movement to fight for a public health system and public health care, we do struggle, I think, to deepen our analysis and the analysis of the local coalitions and the key activists across Ontario and across the country. And we also, and probably more of the time, spend a lot of time trying to find ways to overcome this often overwhelming tide of privatization and marketization and the erosions of the gains that had been made in the public health system in Canada. I wanted to share with you a few stories from that fight because I think you might find them interesting, but also because they really do relate back to the book. I was in the Premier's office not so long ago, maybe a couple of weeks ago, and talking to one of the health policy advisors there, and he said to me, you know, around here, he said, and he's waving his arms, there's a consensus that we do not support democracy in hospitals. In Fort Erie, not very long ago, these are just sort of different snapshots. I'll give you a different one. Today, actually, I was in the office in the Ontario Hospital Association. This is the industry group, the lobby group, and the bargaining group for the not-for-profit, public not-for-profit hospitals in Ontario. It's supposed to be their representative. And we've been doing a research project in which we are calling all 179 or whatever they are hospitals across Ontario, and we're asking them for occupancy data. How many beds are full, and how, because many hospitals are actually overfull. They're running beds that they're not funded for. So what is their occupancy data? And we're also asking about staffing shortages. And today, the Ontario Hospital Association put up a secret memo on their webpage, which must be counseling hospitals not to answer our information requests, because we started to get a whole slew of responses from hospitals saying that they won't tell us their occupancy data or their staff vacancies. A few months ago in Fort Erie, they closed down the emergency department in the local hospital. This is a town of about 60,000 people down on the U.S. border south of St. Catharines and Niagara Falls. It's about 40 minutes, I would say, drive on a good day to the nearest emergency department that is still open in the peninsula. And we fought a major campaign for months to try and save that local hospital from being closed. And when they finally came in to cart away the surgical equipment, close down all the surgeries, the moving trucks came in, and working with the local groups there, we had a protest. And at that protest, a man burned a big H on the lawn of the hospital. There was no damage whatsoever. It was just a big H, very contained. The police moved in and arrested him, and a surgeon went and stood in front of the police car and refused to move until they arrested him also, and another man who also, and the entire crowd surrounded the police cars. These are not normal things to happen in Canada. People are generally pretty polite. In Fort Erie, just weeks before that, in the dead of night, people had snuck out and changed the hospital H to the hospital in an attempt to stop the closure of their local hospitals. And my favorite one by far, we held a public meeting in Wallaceburg, another town where the hospital is threatened with closure. It's a farming town, working class factories and farms down near Windsor in southwestern Ontario. And about 1,800 people came out to the town hall meeting. These town hall meetings around saving hospitals are massive deals, often filling the local arena. And so there were about 1,800 people, filled the school gym, filled the school cafeteria. There was, TV set up and so on so that everybody could see. And the local health integration network, that's the government-appointed regional health board that is now supposed to govern healthcare, was there, and they were supposed to be doing a public consultation, one that we had forced on them. And they had hired a consulting company, and on every chair, for more than 1,000 chairs, they had put these little things like TV remote control clickers, and they had these questions that were coming up on the screen, and they were essentially collecting polling data to figure out how to message the closing of the hospital, rather than, what services do you want, what's your access to care like, what service gaps do you see emerging in your community, etc. And so people saw this, and they were to click yes or no. This was their big public consultation. And so the crowd en masse, and I promise you I did not instigate this, they refused to do it. 1,800 people all at once. One man stood up and he held up his, well, first off they tried arguing with the facilitator for about half an hour, and he wasn't giving up. So one man just stood up with his clicker thing and walked up to the front of the room and put it down on the stage, and before you knew it, the whole crowd was passing them into the middle aisles, and they were all walking them up to the front, and they forced this local health integration network board, these appointees, to listen to 3 hours of stories, testimonials, and opinions from the community about how important and vital their local hospital was to them. I spent the last decade, I think that speaks, by the way, to the central contradiction of this pointed out in the book. I spent the last 10 years traveling incessantly across Ontario, across the country, elsewhere, to try and save our healthcare system and fight for improvements. And what I've seen at CORE is that despite a major campaign to dismantle Medicare across Canada, and this is a campaign that is enormously well organized, well funded. For example, the Fraser Institute, its budget last year was $10.6 million, much of it spent on trying to dismantle healthcare. There are 3 charter challenges now, in addition to the one that was fought in Quebec, funded also by mainly business, often US-based think tanks. to bring down single-tier Medicare in BC, Alberta, Ontario, and in addition to the Charter Challenge that was brought in Quebec. There's a bevy and a ballooning sort of mass of think tanks on the right that are fighting for the dismantling of healthcare and other major social transfers in the country. And despite all of that, everywhere that I go, I find that there's a profound disjunct. Is that a word? There's a profound disjunctive? Disjuncture, sorry, between the sort of neoliberalized policymakers on the one hand and the people of the province on the other hand. And I believe that this holds true for the country. What they don't realize, I think, is that despite the restructuring that has neo-tailorized, to use the words of Pat and Hugh Armstrong, care and work functions, has turned care into hour-long bites, has done time motion studies to figure out how fast you can speed up the cleaners and the nurses, etc. Cut services, decreased access, increased infectious disease, reduced care and work standards, and alienated patients and care workers alike. People wholesale have rejected the idea that healthcare is a commodity. And they reject the turning of care processes into these dehumanizing factory-like assembly lines. In virtually every town in this province, and I know this holds true across the country, the people of the town built their local hospitals. In farming communities, people tell me the stories of bringing their tractors to dig the hole. They literally put up the hospitals. They fundraised for them. They sat on their democratic hospital boards. They sit on their auxiliaries. They have friends of hospital committees. They work as nurses, doctors, paramedics. In Hamilton, where they're cutting hospital services, the hospitals are the biggest employers in town. You may think it's a steel town, but really it's a hospital town. Therapists, they're social workers. Most of them were born in their hospitals. Most of us were born in hospital. Many of us die in our hospitals. Many of us have watched family members die in hospitals. These are vital public services, and the notion of them being commodities is completely counter to the experience and beliefs and core values of just about everybody. This crosses every political stripe. That's why when you're closing a local hospital, you'll see town hall meetings in which the entire town, thousands of people come out to save that service. And people are livid about the idea that their hospitals don't belong to them, the contempt and the elitism of hospital executives these days. People believe that healthcare ought to be led by concerns for prevention and health promotion. That is said everywhere we go, all the time, as well as acute and chronic care. They're derisive about those that treat people, both the patients and the workers, as widgets. They're phenomenally uninterested in quality indicators, efficiency indicators, the numbers of thousands of increased MRI surgeries and so on and so forth that are often used in political campaigns. Those things just wash over them and are completely forgotten. And en masse, people are furious about the ways in which our hospitals and healthcare system are copying the private marketplace, in which executive salaries are spiraling out of control. Consultants' reports, spew gibberish that makes no sense to normal human beings at great cost, even while frontline services and care functions are being eroded. These public values are, I think, the most broadly felt, deep and strong that we can identify in our communities. They connect us, and literally tens of thousands of people, in my experience just in the last year, who've come out to town hall meetings, share them. They quickly spill over and result in the kind of anger and direct action that I was describing to you when the doctor got arrested in Fort Erie and people en masse refused to participate in Wallaceburg. I find this to be inspiring and heartening. I believe that we can win, and we have in fact won some absolutely crucial fights in Ontario, but almost every fight that we're fighting now is a defensive fight. So while we have won, we've stopped the for-profit MRI CT clinics in Ontario. We've stopped the for-profit cancer treatment center in Ontario. We stopped the two-tier Coleman clinics, a chain of private clinics that was trying to move into Ontario. Almost all of the private clinics in Ontario have been completely stopped by citizen action. We have rolled back the P3 hospitals in a way that virtually no other jurisdiction that I've found has been able to do. We've won three moratoria on competitive bidding or market competition in home care. We have stopped the closure of countless community hospitals over and over and over again. But what I've learned is that if we're going to move away from the defensive into expanding and improving and moving just from healthcare systems to healthcare as a goal, or to health, sorry, as a goal, I think I've learned that democracy is key. I believe that it's the antithesis of privatization, and that in a globalized, neoliberalized, capitalist, whatever you want to call it, all of those things, situation, we will not, I don't think, be able to reestablish a public health care system unless we create local democratic structures of some sort to do it. And how you balance the need for central standards and the principles that would underlie that, the philosophy and ideology that would underlie that with local democracy, I don't have the answer to, but I know that I believe that is crucial to the question. I believe that we have to fight the marketization of the processes, the turning of care work into widget-like functions, the copying of the private sector's processes within our public, service as much, and we have to consider that as important as fighting privatization, as in the actual private for-profit ownership of healthcare. Because as you see now, if you end up with hospitals that are virtually the same as private hospitals, but they're the public sector, it does not do you any good either, and very hard to defend, very hard to build movements around. I believe that size matters, that working in social movement methods is crucial. In my own experience in the last 10 years, I found that the social movement has both moved the labor movement left on healthcare issues and also moved the community movements left on these issues. And I believe that the demobilization, that this total lack of mobilization in society to fight for anything is a crucial problem. The loss of the left, I don't want to say ineffectiveness, but the weakness of the left is part and parcel of handing the sort of victory over to the right. And I want to say that I so appreciate all the work that everybody here does. It's tremendous, and it really, I think, does provide some ideological grounding for those of us that are trying to build a social movement to save and hopefully recreate this crucially important human enterprise. Thank you.
I think the volume for me and the discussion tonight has raised a few issues that I didn't fully put together before until reading this. One is was from Tudor Hart, you mentioned earlier, of those who have need help the least get the most, and those who need it the most get the least, is the way that has occurred under neoliberal globalization, that occurs within countries, but it's also the way the entire world economic system has been operating, with the polarization of healthcare, the stripping of healthcare facilities from the South, doctors, nurses, and so on, is a dynamic that has been both national and international. The other thing is, I think what Natalie said is that the struggles around healthcare have been really and deeply about democracy. And even when we've been maintained it within the public system, there's been major blockages to the issues around democratization. And it's of course, as neoliberal executives man the health system, this question of we certainly don't want democracy in our hospitals comes more and more prominent. And it seems that links to the struggles we have about thinking about alternative ways of living, alternative health systems, which is inextricably linked, I think, to the struggle that we're dealing with as a whole, is the way that healthcare and health systems and thinking about the human body and the way that neoliberal globalization has been attempting to penetrate new forms of accumulation in all these sectors really is then linked to the question that Andy spoke to, the revitalization of socialism and the socialist project. which is what this issue of the Socialist Register, I think, puts on the agenda in thinking about healthcare as one of those essential needs, which is coming up more and more abruptly against what neoliberal globalization is today. And quite strikingly, I think, in the way that the financial crisis is unfolding, that we're seeing a more authoritarian form of neoliberalism. And I think what Natalie was speaking about in terms of the exit strategies, they're so-called exit strategies from the stimulus packages, from the financial crisis, is going to raise these very, very sharply. So comrades, thank you for the evening. They're still collecting for the Ontario Health Coalition, I would think, somewhere at the back.
Sure.
Sure. Thank you for the evening, and buy a copy of the Socialist Register if you get a chance. Bye. Or two.